Today, we're diving into a medication that's a real game changer in the fight against certain types of breast cancer. It's called anastrozole, and it acts like a smart blocker. We're going to break down exactly how it works, who it's for, and what you really need to know about it. Okay, so right off the bat, let's get one thing straight, because it's a super common point of confusion. Anastrozole is a type of hormonal therapy. It is not chemotherapy. Think of chemo as a broad attack on any fast-growing cells. Hormonal therapy, on the other hand, is way more targeted. And we're about to see just how precise it can be. So here's our game plan for this explainer. First, we'll look at the cancer's unexpected fuel source. Then, we'll see how anastrozole cleverly cuts off that supply. After that, we'll dive into the specifics of a treatment plan, weigh the benefits against the side effects, and wrap it all up with a really essential safety checklist. To really get how this drug works, we have to start by understanding the cancer's biggest vulnerability. As it turns out, some cancer cells are actually fueled by something our own bodies make every single day. You see, a lot of breast cancers are what we call hormone receptor positive. Now, what does that mean? Just think of it like this. These cancer cells have these little docking stations, or receptors, on their surface. And when the hormone estrogen comes along and plugs into one of those stations, it's like a key in an ignition. It sends a signal to the cell that says, go, grow, and divide. It's literally using the body's own estrogen as high-octane fuel. So you might be wondering, where does all this estrogen fuel come from? Especially after menopause, when the ovaries, which are the main producers, have mostly shut down. Well, that's where this other key player comes onto the scene, an enzyme called aromatase. It basically becomes the body's new primary estrogen factory, watching in places like fat and muscle tissue to convert other hormones into estrogen. Okay, so we've got our problem, right? A cancer that feeds on estrogen, and a factory, that aromatase enzyme, that's cranking it out. The solution, then, is actually kind of brilliant in its simplicity. You just shut down the factory, and that is exactly what anastrozole is designed to do. The whole process really breaks down into 4 simple steps. Step 1, you've got the estrogen fuel telling the cancer to grow. Step 2, you've got the aromatase factory making that fuel. And that's where anastrozole comes in as the blocker in step 3. It goes right to that aromatase enzyme and shuts it down. The result? Estrogen levels plummet, and the cancer is effectively starved of the fuel it needs to survive. This quote from our source material just says it all perfectly. The cancer cells are starved. See, it's not a poison that kills everything in sight like some treatments. No, it's a precision strike, aimed squarely at the cancer's supply line. And that targeted action is what makes it so incredibly effective. All right, so now that we get the how, let's dig into the specifics of the actual treatment plan. Who is this medication for? When is it used? And what does the day-to-day look like? Anastrozole is used primarily in postmenopausal women. One of its key uses is as what's called adjuvant therapy. All that means is it's taken after surgery, sometimes for 5 or even 10 years, specifically to stop the cancer from ever coming back. It's also used to treat advanced cancer that may have spread, or sometimes as a follow-up treatment after someone has been on another drug called tamoxifen for a few years. And the dosage? It's really straightforward. It's just a tiny 1 milligram tablet taken once a day. You can have it with food, without food, doesn't matter. But the one thing that is absolutely crucial is consistency. Taking it at the same time every single day is the key to making sure it works as well as it possibly can. Okay, let's talk about something that's, really important for anyone even thinking about this medication. When you dramatically lower a hormone in your body, it's going to be powerful, but it's not going to come without some effects. We have to talk about the trade-offs. So on the left, we've got the more common side effects. A lot of these feel like intensified symptoms of menopause. We're talking about things like joint and muscle pain, hot flashes, fatigue. But then on the right are the less common but more serious concerns that doctors watch like a hawk. Things like bone loss, a rise in cholesterol, and a small but real increase in cardiovascular risk. Now, while managing those day-to-day side effects is definitely part of the journey, there is one major long-term concern that really requires constant attention from both the patient and their doctor. And that is bone loss. This is really the core trade-off. See, estrogen is absolutely critical for keeping our bones strong. So by starving the cancer of estrogen, the treatment, unfortunately, also starves the bones a bit, which can speed up bone loss and increase the risk of osteoporosis and fractures down the line. But And this is a really, really important but. This is a risk that is actively managed. Your medical team will be all over it. They'll monitor you with regular bone density scans. They'll do blood tests to check your cholesterol. They'll often recommend supplements like calcium and vitamin D, and if needed, they can even prescribe specific drugs to help strengthen your bones.
Finally, let's just quickly cover the essential safety rules, because there are some very clear-cut situations where anastrozole should not be used and a couple of key interactions you really need to be aware of.
And this part is absolutely non-negotiable. This drug can cause harm to a developing fetus, so it must never, ever be used by women who are pregnant or who could become pregnant. It's also not meant for premenopausal women, simply because their ovaries are still the main estrogen factory, and this drug doesn't target that.
It's also vital to avoid two other things. First, you can't take tamoxifen at the same time because it can actually make anastrozole less effective. And second, you have to avoid any kind of therapy that adds estrogen back into your body, like hormone replacement therapy. I mean, that would completely defeat the entire purpose of the medication.
And just a quick special note to give you the full picture. While this is mainly a drug for postmenopausal women, it is sometimes used off-label in men for conditions like male breast cancer. But you should also know that it's often misused in bodybuilding circles to try and counteract the side effects of anabolic steroids, which is a really dangerous, unsupervised thing to do. Look, anastrozole is an incredibly powerful and effective tool. It's a smart blocker that very cleverly starves certain cancers of their fuel. But any treatment like this is a journey, right? It's a careful balancing act between the benefits and the risks, which really leads us to the most important question of all. How can patients and doctors work together as a team to make sure that they're not just getting a good medical outcome, but also a good quality of life?